You've minced your words when you've written your op-ed for the New York Times, saying you see this as another flawed plan. Let's be specific, though. What does this mean in terms of cuts for Ohio?
Well, it's not just Ohio, but it's a 17% cut off the top from the base level. And that really is going to either impact those folks who receive coverage through Medicaid expansion, or it will affect those people who need subsidies in order to buy health insurance. But let's really get to what the real problem is. It's like a ping pong match. Julia, I don't know if you know much about ping pong, but the Democrats did it without any Republicans. The Republicans hit the ball back over the net, and it's back and forth and back and forth. And there was a proposal that the governor of Colorado and I put forward that would give states significant flexibility and allow states to keep exactly what they have, as long as it didn't result in people being able to lose decent health care, and as long as we didn't have large segments of the population that lost coverage. So, I know they're going to try to do this. I don't know if they're going to get the votes or not, but this is not going to settle anything down. And at a time when we saw a little bit of sunlight, you remember we got kind of bipartisan agreement, there was some hope. This is kind of like reverses all that. So I don't think this is the way to do it. I think the first thing we need to do is to stabilize the insurance markets, which could become significantly disrupted as a result of the passage of this bill if it goes all the way through. I just don't think this is the way you do things. And I was involved in Congress in doing welfare reform and balancing budgets. We did it together. We didn't do it just one party jamming something through.
Governor Kasich, have you had conversations with Senator Portman about how he sees this bill? No,
I haven't. I understand he has indicated, look, Joe, I've made it clear to everybody, as I had a call from a Democrat governor the other day. I said, the only thing I can do more than what I've done is go to the top of a building and set myself on fire about the need to do this in a bipartisan way. They all know how I feel. I mean, there's no secret here. And the idea that, you bring pressure to them or whatever, it doesn't work that way.
Governor, you just said it there. You indicated that Senator Portman is going to be on board with this. Why? Why is he on board with this?
Call him and ask him. I can't speak for him.
But why are any of the governors that are in states ultimately, and senators, that are in states ultimately that are going to see cuts here on board?
Well, look,
is it that the political pressure to make a decision here is more important than the content?
No, I think there's a lot of politics involved. They made a pledge, repeal, and it's repeal and replace with something that I don't think is adequate. I do believe that Obamacare is flawed. I do believe it can be fixed. And if you look carefully at what Hickenlooper and I and a bunch of other governors proposed on a bipartisan basis, it does take us in the right direction to stabilize the insurance markets. It gives me the ability to basically write what I want within certain guidelines. I can't speak for other people. I can just tell you, look, it isn't going to affect me now. I'm governor for another year or so. But I think about what impact this is going to have long term, not just on the state of Ohio, but 319 million Americans. What's it going to mean? I'm reading today, because we haven't really seen much of this bill, that if you have a pre-existing condition, an insurance company has to provide insurance for you, but there's no limit on what they charge you. So does that mean you get pre-existing coverage? It doesn't sound like it to me. So look, I don't know what to tell you. We'll see what happens. It's going to be in the hands of a few senators who are going to have to decide what they think is best for our country.
Governor Kasich, I want to get into in a second the specifics of what you think it would mean for the voters of Ohio. But listening to what you're saying, it sounds like a pretty big chunk of your frustration is in the partisan manner that the process through which this has undergone. And you talk about bipartisan several times. Is that the key source of your frustration, the way it's gone about?
No, not just that, but you take a 17% cut in the base. And I actually think you can, over time, reduce the amount of money that the federal government puts in. But I think we also have to have a little leverage out here. In other words, there's nothing in there that forces the pharmaceutical companies, which is our single biggest cost driver today. There's nothing in here that gives me additional leverage. And look, I'm for the states having more power, but I also believe there ought to be a few guardrails. I kind of think that when we have an opiate crisis going on all over the country, Things like that have to be addressed. If you run out of money, how are you going to help people? I happen to believe the issue of mental illness is very important as well, and there's no guarantee that these people are going to get help. So to me, give us flexibility. Over time, reduce the funding, but have some guardrails. And that's basically what I have proposed, and I think it makes the most amount of sense. But right now, there doesn't seem to be Alexander and Murray. There doesn't seem to be anything happening. They declared defeat. It smells a little like politics to me.
It smells a lot like politics to others, I think, Governor, as well. Just to go back to what you were saying there about Medicaid and obviously what's going on with those with pre-existing conditions as well. Will you do whatever it takes to protect those with pre-existing conditions, that they won't ultimately have to pay more here?
Sure. I mean, you can develop a plan that can have reinsurance.
No, I mean,
if
this plan goes through, will you do whatever it takes to prevent those with pre-existing conditions from paying more?
It's not going to affect me, Julia, because I'm not going to be governor for that much longer. This kicks in like 2020, so it'll be in the hands of the people who are yet to come. And but I don't think it's the right direction. I do think you have to protect people with pre-existing conditions, because it could be your own family. And, let's think about it. If you have somebody in your family that has a pre-existing condition, even though they need to be covered, but they can't afford to pay for the coverage, what happens to them? And then all of a sudden, you're in a spiral that could actually lead to things like bankruptcy. So I don't think that's good.
Governor, you yourself said, you like the idea and principle of states having more flexibility to design health care plans that suit the people's needs. That's, of course...
But with guardrails. Right. But with guardrails.
So from the perspective of a governor, if given the option, let's say the guardrail issues were taken care of, money weren't an issue, how would you like to reform Ohio's healthcare system?
Well, first of all, we've done our Medicaid program in Ohio is growing by less than 2%. I would argue that it's the best managed Medicaid program in the country. And that is because we took on a lot of battles. We were able to place people into managed care. There's a lot of states that don't do it. We've been able to, over the period, we've taken a Medicare growth from 9% down to less than 2% now. I think we're managing that pretty well. Where we ultimately want to go, not just in Medicaid, but in health care in Ohio, is to pay for quality and pay for performance, and let the market work to reward those that provide good quality, that have good performance, not the current market system that really demands that you do quantity medicine. So it's a number of things that you have to do, and we've started it out here, and we hope to grow it over the period of the next 15, 16 months.
Governor, what happens, do you think, for the GOP if they pass this measure and then the CBO comes out a week later, however long it takes to give their assessment here, and it looks pretty bleak? What politically do you think happens here?
Well, I mean, it'll all depend on whether people are aware of it. People don't like Obamacare, but if you ask them, do you want to take away their health insurance, they say no. Julia, look, why don't you get some pollster or something on there? I don't like to get into speculating what's the political impact. What I'm concerned about is the impact, seriously, on people. I'm concerned about the impact on the chronically ill, the mentally ill, the drug addicted. We're covering now 700,000 people. Our uninsured rate is at an all-time low in our state. Still has room to go, but that's working. I'd like to see a very strong insurance market where people can be in exchange, where they can have reasonable subsidies if they need it to be able to afford health insurance. I'd like to think about different ideas like moving the healthier people from Medicaid into the private system. But none of that is really provided for here. And frankly, when you ask me all these details, there isn't anybody that knows what all the details are or what all the impacts are. I would never. Back in the days of Congress, we wouldn't have, we couldn't move a welfare bill. We couldn't move a balanced budget unless we had people in the other party that signed off. And those things have been stable because we did it together.
How much of the move to repeal or to pass this bill, in your view, is just a feeling of political commitment? The party said over and over and over again that they were going to repeal Obamacare, and they just feel that regardless of the content, they've locked themselves into that call.
Well, the reason I don't really want to answer that question is I start questioning people's motives. There is no doubt that the campaign pledge to repeal and replace is very important in the minds of some. But there is also legitimate concern, and I share it, with the tedious nature, the over-aggressive rulemaking that you see in Obamacare. I'm not saying that it should stay as it is. I'm just saying the first step is to reach agreement on stabilizing the market. And I've told those who support this bill, I'd be more than glad to work with them on the reforms of not just Medicaid, but Medicare and Social Security. And whenever I mention Social Security, there's a buzz in the room, everybody gets nervous. But look, you guys understand, and lady understand, we're now at the $20 trillion debt situation here. And we are a slow growth country now, and we need to get out of it. And that means we have to deal with entitlements. But first things first, and let's do it in a way where we're going to make sure that people can have the kind of health coverage that they need.
I want to move on, actually, Governor, and talk to you about tax reform now. The Senate Budget Committee are apparently talking about making room in the budget here for up to $1.5 trillion worth of tax cuts here, and that won't be deficit neutral. Is that a huge mistake in your view?
Well, I do believe that the tax cuts, when properly implemented, yield economic growth. But I'm not a believer that if you just cut taxes, just all this magic happens. I think it's more complicated than that. Kansas tried to do that, you know, the state of Kansas, and they had to turn around and raise taxes. Here in Ohio, when we've cut taxes, it's been because we felt that we had enough revenue to be able to give some of this back to people rather than to raise spending. I know that there are senators now beginning to talk about their concern about just cutting taxes without being concerned about the deficit. I think you have to be concerned about the deficit. I support a constitutional amendment that requires a federally balanced budget. And now there's a bunch of states, I think Democrat states, that are kind of repealing the fact that they passed a constitutional amendment to call for a federally balanced budget. We were up to 30 states making great progress. And Disneyland, I guess we're in Disneyland or something, the debt's $20 trillion and people are moving the other way. I mean, I can't explain that to you, Julia.
Governor,
you guys are hitting everything, every topic.
Well, here's the key question, Governor Kasich. What would it take for you to see in the Republican Party or President Trump's behavior for you to feel like you had to try to primary him in 2020?
I'm not even thinking about anything like that. My focus now is on, first of all, having a voice that can point some of these things out. You know, a lot of people get worked up when I do it. That's okay. I feel strongly about saying these things for the good of the people out there as I see it, and people can disagree with me. But I also believe that a lot of what ails this country is not just what's happening in Washington. You report on Equifax and Wells Fargo, and we got football players that beat up their girlfriends who were on the field on Sunday. It's really across our culture. And I think we're in a tug of war. And, you know, about where we're going and ethics and all that, and none of us are pure. I mean, we're all hypocrites. I'll be the #1 hypocrite. But, you know, when I look down in Houston and I look down in Florida and I see these overwhelming things and I see people saying their prayers and they feel like they have nowhere to go. But I kind of think that in our own lives, as we struggle to create more compassion, more togetherness, maybe we ought to say our own little prayers to give us more strength and more effectiveness to bring our country together, because it's not just politics. It's everywhere today. I think you can all agree. And can we win this? Can we get back on track? I think we can. But we may need a little help from our friend who happens to be living upstairs.
And someone who doesn't live upstairs that can promote all of these issues, so someone who's inclusive. I have to ask you once again, can we rule you out then for 2020, yes or no?
I'm not talking, let me tell you what you can rule me in for.
That's not a no.
Finishing today and being as good a governor as I can be. I don't know what the future is. I'm not making any plans in any way, but I'm also not out there trying to organize something around the country. So I'm sorry, Julia, I just can't, I'm not a fortune teller or, you know, predictor. I'm just not. Although I will predict today, most definitively, that the Cleveland Indians are going to win the World Series.
All right.